So this is kind of in good context and a good segue from estrogen dominance, because there are multiple factors that affect your levels of sex hormones and also how effective whatever is there is going to work. Okay, so for instance, we were just talking about estrogen dominance. There are certain things that are going to make you more estrogen dominant and other things that will make you less estrogen dominant. And we're going to talk about some of those things right now. And a lot of them have to do with lifestyle, which means that they are under your control. Now, one of the biggest things, probably the biggest thing, that affects female sex hormone balance is stress. And stress comes in many forms. It does not have to be just psychological. And there are other webinars that will be discussing stress and cortisol in much more detail. But for the purposes of this webinar, what I would like for you to understand is that if you have stress, your female sex hormones will not work the way they are supposed to. Because when you have stress, your body is in a situation where it is either going to get you out of dodge or you are going to mount a stress response so that you can fight off whatever the stressor is that's facing you. The primary hormone responsible for that is called cortisol. And because cortisol is your primary survival hormone, if cortisol levels are elevated, none of the other hormones are going to be produced properly. And there are multiple different ways that this happens, but your body basically just wants to guarantee that if you're in stress and you're constantly stressed out, you're probably not in a good position to reproduce, which is one of the main reasons why women make female sex hormones. So if you're too busy running away from a lion, then there's really no interest on the part of your body to engage in reproduction. So cortisol will feed back to multiple areas in the brain and to the ovaries to actually shut down the production of testosterone, estrogen, progesterone, and DHEA. Okay. The other thing is, let's just assume that some hormones are still being produced. I mean, obviously they're going to still be there, just in much lower quantities. Or perhaps some of you are on hormone replacement therapy. If you have a lot of stress and your cortisol levels are abnormal, then whatever sex hormone levels are there are not going to work as well. Your tissues will become resistant to the effects of the sex hormones. Okay, so stress is going to whammy your female hormone balance in multiple different ways. And because of the relationships between these hormones, stress can create all kinds of symptoms of all kinds of different hormone system imbalances because of that significant impact of cortisol on every single metabolic system in your body. So stress is a biggie. All right, let's talk about alcohol, because we're all told that some amount of alcohol every day is good for us. It's good for our heart health and it helps to lower our cholesterol. And certainly there is some truth to that. There's been research on that. But one of the things that you need to be aware of, and this is not quantity dependent, anytime you put alcohol in your body, it is going to affect your hormones, okay? And usually in a way that's not good. So we were already discussing how, unless you are a hormonally balanced woman, either because you're on hormone replacement or because you live in a perfect scenario, which is quite unusual, then if you drink alcohol, you will become more estrogen dominant even after one sip of alcohol. It changes the way your body processes hormones. And it has effects on certain enzyme conversions so that the ultimate effect is going to be higher levels of estrogen and higher levels of cortisol. And those are two hormones that are incredibly important and do incredibly important things, but can be incredibly harmful for you if they are there in high amounts. The other problem is that the hormones that balance estrogen and cortisol, so the hormones that balance estrogen are testosterone and progesterone, and the hormone that balances cortisol is DHEA. So when you drink alcohol, not only do you become more estrogen and cortisol dominant, but because you reduce the levels of the hormones that balance estrogen and cortisol, drinking alcohol makes you estrogen and cortisol dominant in two different ways. By increasing the levels of estrogen and cortisol, but also by lowering the levels of the hormones that balance them. So it's the ratio, about the balance between the hormones, that's also very, very important. And this is true of any type of alcohol, not just wine. Smoking. So smoking, again, a substance our bodies are not used to being exposed to. And obviously not just the nicotine, but all of the harmful carcinogens and other additives that are included in the tobacco. But in general, smoking does the same thing to the hormone balance as alcohol. So you're going to get a rise in estrogen and cortisol levels, and you're going to have a reduction in testosterone, progesterone, and DHEA levels. And it's because of these hormonal imbalances that when you stop drinking or you stop smoking, sometimes you'll see an opposite effect for a while. So for instance, cigarette smoking can initially cause weight loss in some women. And sometimes when women stop smoking, they'll notice that they start to gain more weight or they become more tired because nicotine is a stimulant. So obviously with initial cessation or discontinuation of smoking or alcohol, there may be a regression of symptoms. You might feel a little bit more tired, you might gain a little bit more weight, but those are things that can be easily rectified if hormones are properly tested and properly balanced, and just give it time. I cannot stress the importance, it's probably number 2, as far as what you put in your mouth and the effects of what you put in your mouth have on your body. So if you eat garbage, you will feel like garbage and your body is not going to work at its optimal level. I put the most obvious things on here, fried foods, fatty foods, processed foods. The more processed a food is, the more it's going to disturb hormone balance in the body, among other things. So even if you're eating a prepackaged dinner, frozen dinner, I don't want to mention any brand names, but a prepackaged frozen dinner, the more ingredients that are on the label of a package, the worse it is for you to consume. And in particular, these kinds of foods are going to mess up your cortisol, they're going to mess up your insulin, and because I just told you cortisol affects every other hormone in your body, every other hormone is going to be messed up. I have animal protein on here because all animal protein has estrogen in it, whether it's organic or not. If it's organic, the levels of estrogen won't be quite so high, but with the exception of fish, every single type of meat product is going to have some type of estrogen in it. Also, animal proteins are very, very high in inflammation. And when you have inflammation, it's going to stimulate the stress response, which is going to increase your cortisol and your estrogen, and then create hormone imbalance that way. So I'm not necessarily suggesting a vegetarian diet. I'm merely providing you with information. Red meat is probably the worst offender, so it's best to keep your consumption of red meat to an absolute minimum. Ideally, the recommendation is to have red meat no more than once a month, even if it's organic. So your diet needs to focus on fresh fruits and fresh vegetables, lean protein, fish, beans, nuts, other legumes, things of that nature. Now, of course, it's a general global recommendation. Diets will vary based on other unique factors that are unique to each individual, but that's a basic general recommendation for you. And again, there are many, many other things that will affect hormone balance. These are just some of the more common things that people can identify with and can actually take proactive steps towards changing. So in conclusion from this webinar, hopefully you now have an even greater understanding of how important your female sex hormones are, not only in helping you to feel good now, but also in order for you to maintain your health and prevent disease. That's why most of the women who are in menopause, in fact, most diseases that women develop occur after they go into menopause, and it's because they lose the beneficial effects of these hormones on their metabolic pathways and metabolic systems. Also, lifestyle plays a significant role in your hormone balance. There's certain things that you're going to do or that you may be doing that increase estrogen or that lower progesterone and testosterone. So those things, some of which we've already discussed, are under your control. And so you can have a direct impact on your hormone balance just by changing some of your unhealthy lifestyles. Hormone levels can be tested. And so if you're interested in having your hormone levels tested, it is possible to do that. However, different hormone levels are accurate in different bodily fluids, and so blood testing is not always accurate, for instance, for estrogen and progesterone or for cortisol. So there's ways to test these hormone levels, but it needs to be done correctly. and there's going to be also a webinar on this, so you can get more information about that. So if you are interested in hormone replacement, you need to make sure that the levels are being tested correctly so that you're put on the proper type of hormone replacement. If you're doing the wrong test, you'll get the wrong information, you'll end up on the wrong hormone regimen. And again, given all of the positive health effects of these hormones, I strongly recommend that for those of you in whom it's indicated, you undergo hormone testing and proper, safe, low-dose bioidentical hormone replacement for disease prevention and maintenance of health. Thank you for your attention. And please also make sure that you've downloaded the accompanying PDF that goes with this webinar. And please also browse through the other selection of webinars that will also complement the information in this webinar. Thanks for your attention.